to come and talk to you about this issue, which I'm very passionate about, and I know many of you are passionate about this issue as well. Going to share some perspectives that I've learned along the way, but also as Angela mentioned, I've been working for the NHS in the UK for the last 9 years before coming back to Canada in February. So we'll share with you some experiences of the work that they're doing there, because that has been adopted and applied in green care work in Canada. So we'll get started. I just want to also acknowledge as well the traditional and unceded territories of the Coast Salish and Naklapamat nations upon which Fraser Health delivers services, and these nations have, of course, been environmental stewards of our area for over 10,000 years. So 2021, of course, don't need to remind anyone what a difficult year this was for British Columbia in terms of climate events. Nearly 600 people died in the heat dome and heat waves during the summer. Of course, the flooding, unprecedented flooding that we had, and the wider impacts on the determinant of health. This was the tied for the sixth hottest year in record in history, in spite of the cooling effects of La Nina. And the average rise in temperature was the seventh year that it was above 1 degree, taking us ever closer to the Paris Agreement target, which we're trying to meet. And that brings us to our first poll question. I'll get you involved right away. So what is the global temperature increase that the agreement aims for in order to mitigate the worst impacts of climate change? So have a think about that, and we'll wait for your results in a minute. That's great. I think everyone is answered, and we've got 1.5 degrees as 39% and 2 degrees as 36%. You're both right. 2 degrees was kind of the official target. 1.5 degrees was the target that was seen to be able to try to stave off the worst impacts of climate change. And that's a critical, important piece for us in limiting that increase. We know that every avoided increment of warming will reduce extremes such as heat waves, droughts, and it also decreases our risk of crossing tipping points in the Earth system. So here's another question. It's not a poll question. Feel free to drop something in the chat. There was a significant event milestone in human history in 1804. So if you want to have a think yourself, or drop something in the chat about what you think this was. I'll just give people just a few seconds. Steam engine. No other guesses. You're waiting in anticipation, so I will share it with you. We reached 1 billion people on the planet for the first time in human history. It took a long time to get there, and we've had significant increases in our population since then, and a lot of that has been due to the efforts of public health, which have improved the health and well-being for many people. But this in terms of just understanding, where we are in terms of this planetary health agenda, I think it's important to understand the background of how quickly things have changed, and how quickly our population has increased. Here's another question. Just throw it in the chat if you'd like. What is the term for the unofficial unit of geological time used to describe the most recent period in Earth's history when human activity started to have a significant impact on the planet's climate an ecosystem. And it was a 2017 documentary as well. And there's also a great YouTube video of this that you can look up. But does anyone have a guess of what that is? Anthropocene, yes, exactly right. Yes, the Anthropocene, just a small blip in the Earth's long history. My little boy is learning about dinosaurs right now, and that's 200 million years that they were around is such a long period of time. And we've made such a significant impact on our planet in such a short period of time. And really this kind of started in around 1950. The left side, lots of graphs here talking about socioeconomic trends around GDP, population I mentioned, use of hydro and damming, tourism. All of these things have just increased so significantly in parts of our lifetime. And of course, it has had a significant impact on Earth system trends. Things from, we know, of course, about global warming, but ocean acidification, methane in the atmosphere, domesticated land, forest loss. So it is, and this has been termed the Great Acceleration because of how quickly these trends have happened. So here's our second poll question. What proportion of wealth do the bottom 20% of Canadians hold?
Address return anxiety.
Right, so 40%, 2%, 35%, none, they are in debt. You are correct, those 35%. And the reason I bring this up, have jumped from Earth systems discussion to the economy, is because we can't talk about addressing planetary health issues without talking about the economy. And there's so much discussion around needing growth, and we know that growth is not actually benefiting the vast majority of the population. I don't know if anyone, just put it on the, if let's put it on the chat. There's been a story in the news around disproportionate climate effects of the wealthy, of the super wealthy. So if anyone wants to share in the chat what they think that was, we'll carry on though. So what I want to talk to you mainly about today was the roles of the healthcare providers and systems in addressing the climate and ecological crisis. Because there are some really practical things that we can do to take this on, and I think this is a nice kind of framework for looking at that. The first role is making sure that we're actually communicating the impacts on public health, so that health lens on this issue, and also thinking about the impact it has on our health and social care infrastructure. And thinking of also, of course, that inequalities, inequities lens into all mitigation and adaptation efforts. So the first piece of this, just as a basic level, is going back to the 2009 Lancet Commission on climate change, which noted that this is the greatest climate change, is the greatest threat to our health and well-being, and unfortunately threatens to undermine many of the public health gains that we've made in the last several decades, and will increase inequalities locally at a global level, and of course for the next generation. There's been a lot of work done to understand the impacts of climate change on human health. What's interesting is these frameworks. You can look in the news and you can start to identify examples of them so easily. So these have changed, things have changed, and they're just ramping up so much around climate breakdown events. But we need to be aware of all of these and be able to frame the impacts. And I'll just go through a couple of examples of these. So here is our impacts of ED visits in Fraser Health during the heat dome event. So you can see that with increasing residential instability, there was a rise in ED visits. And as I mentioned, we knew that nearly 600 people died during that event and the subsequent heat waves. Mental health, probably not as talked about as much, but there are of course immediate direct impacts from events that are happening. There's longer impacts around changes to infrastructure and food shortages and rising inequality. But I also wanted to highlight the climate anxiety, climate grief, called different things that many of us are dealing with, but particularly children and young people. And there's a stat that showed 1 in 5 children between 8 and 16 report sleep disruption at night because of climate worries. And we're teaching this in schools, which we should be, but kids get this and they're worried about it, and so it's another motivator for us to really begin to address this issue in such an urgent manner. Air pollution. Air pollution still kills 15,000 Canadians a year. That's similar to what the mortality from COVID. And of course, it has all other non-fatal health impacts. Yet our urgency around addressing air quality issues is not what it needs to be. So there's a lot of work to be doing around that and to mitigate the impacts on human health inequities, and the impacts on our health system. This is also an ecological crisis. And of course, climate change and the ecological crisis are overlap and can exacerbate each other. But we know that biodiversity is declining faster than any time in human history, with current extinction rates around 100 to 1,000 times higher than the baseline rate. And if you've been reading the headlines the last few weeks, they've been focused around entering the great sixth mass extinction. So this is certainly also in the public's eye, and is of concern in terms of a public health impact, because we know that deforestation and extinctions are more likely to make pandemics part of our lives, and we've already seen the devastating impacts of COVID-19. In British Columbia, I always think of British Columbia as being a natural wonderland, but we know that we have a lot of work to do in terms of protecting that. And in fact, a recent report card that came out showed that we failed all but one measure of our protecting our biodiversity and land. Mentioned a few times about health inequities and how important this is in terms of it being the climate agenda being a health inequities agenda. We know that if all the citizens of the world live like we do in Canada, we'd need 4.7 Earths to sustain us. So in terms of those global inequalities, we know that we have a role to do in Canada. We know that this has disproportionate impacts on our Indigenous communities. We know that the wealth for the 1% has greater impacts on those who are the lower emitters and countries who are lower emitters. We know that climate refugees continue to be an issue. We even had people, of course, having to lost their homes in British Columbia. Poverty and food insecurity will continue to be issues that we're going to be facing. And I mentioned before around, of course, the next generation and putting this on them. So this isn't a poll question, but you need to understand as well the risks to our infrastructure. So if people have any thoughts on what proportion of health authorities in Canada have assessed the vulnerability of their facilities to climate change risks, there's a report that came out recently, actually highlighted that we could be at risk of increasing costs of up to $1 billion by mid-century from climate change on the healthcare system. And we also know that, there are risks to our facilities and infrastructure. So the answer to this is about 20%. So about 1 in 5 health authorities have actually done and assessed the vulnerability of their facilities to climate change risks. The next piece, this is the climate agenda. It's a scary agenda. There's really difficult conversations to be had around this, but it's also the greatest public health opportunity of our time, it's been called, and it is for good reason, because environmental action can create so many population health co-benefits. Everything from more green space, which we know makes people healthier, cleaner air, cleaner water, healthier eating, more active travel, community cohesiveness. It's a real, and of course, getting at those inequalities. It is a real opportunity for us if we're willing to embrace it and secure those population health benefits. We also know that we need to be connecting these benefits with the right evidence. There's actually a study that was done at UBC that identified that that information around the actions that people can do are not being taught either in schools or labeled in government policy. So we should still recycle. This is not in any way saying that that's not important. We need to be doing that, but we also need to be looking at other issues that have inequalities issues, and make sure that we have the right information to make the choices that we're making and the policy decisions that we're making. The other, of course, important task that we can do is to make sure that we're making our own healthcare operations and action plans, make sure that we're working towards provincial targets around biodiversity and even net zero, if that is our ambition, which other healthcare systems have taken on. So here's our next poll question is, what is the approximate carbon footprint of Canada's healthcare system? Okay, so we've got a lot of people, 15%, 10%, the two highest answers. That it's actually 5%. So it's not as bad as people might think, but still a significant contributor to greenhouse gas emissions. Just roughly about 4%, 4.6%. It's estimated to be, but also produces 200,000 tons of other pollutants. And results in 23,000 years of life loss every year in Canada due to disability or early death. And there is a lot of work going around globally to address this issue. There's Healthcare Without Harm is one group. We also have Canadian Association for Physicians for the Environment, who are taking this on, and the Centre for Sustainable Health Systems in Canada, doing a lot of work around this issue. And of course, there's a lot of work that we can take on in our own roles. Just share with you a few examples. So as I mentioned, the NHS in the UK has an ambition to reach net zero by 2040, but even more ambitious is to reach 80% reduction by 2028 to 2032 of their direct emissions. So they are looking at significant action required to meet these goals. So it's an opportunity for us to look at this, one of the world's largest health systems taking this on, and learn from them. And certainly we've taken a lot of the modeling that they've done to understand the impacts and used it in Canada. And here's one example of that. And this is a breakdown of the carbon emissions of the health system in the UK, which we've been able to apply to Canada. And try to, but there are opportunities for us, of course, to do our own assessment of these issues. And I'm actually working on a project with Angela right now around MDI usage. MDIs are a type of inhaler. There are two different types. This type contain these F gases, which are very powerful greenhouse gas contributors. In fact, it can be up to 1,000 to 2,000 times more powerful than carbon dioxide. And we know that we prescribe hundreds of thousands of these a year in Fraser Health alone. And we know that so one of these would be equivalent to basically driving to Merit. So it's such a small device that can actually cause such a large amount of our greenhouse gas emissions. But aside from the reducing greenhouse gas emissions, system change around this issue can also improve patient care and reduce inequalities in health outcomes. We know that 1 in 3 asthma patients are not properly diagnosed. So there's a real opportunity for change there. We know that 90% of inhaler users have poor inhaler techniques, so they're not getting the benefit from it. So there are huge opportunities for improving that patient care by addressing some of those issues. There's also an opportunity for engaging providers in this issue, but in the wider climate agenda, and thinking about what they can do. And there are whole primary care work streams around this as one example in terms of reducing their environmental impact. And we know that patients care about this, and it's an important issue for them, and they want to be involved in choosing, making choices for their care that have less of an environmental impact. Also, there's an opportunity for looking at cost savings if we're prescribing when we shouldn't be, and reducing waste. As I mentioned, hundreds of thousands of these devices a year, ending up, probably a lot of them ending up in municipal landfill. And also looking at a chance to advocate for healthy public policies. What is driving some respiratory conditions, and actually addressing some of those causes. And from an organizational reputation perspective, it shows that we care about this issue. It shows that we care about our patients. And this is just, as I said, this is just one example of different system change that we can look at in the health system. Right, what is a microplastic? Again, we'll just put this on for chat as opposed to poll question. Anyone want to have a guess? Yes, number 2. It is defined as any fragment of plastic less than 5 millimeters, and estimated to be about 24 trillion of them in our environment. There's a study done at UVic that showed that we're consuming tens of thousands of pieces of microplastics every year through respiration, ingestion, and drinking. We do use a lot of plastic, both in society and as a healthcare system. And we know that some of that can be avoidable. And there's systematic work going on to understand the important use, of course, of that plastic in many things, but how we can do things differently. And there was one study, of course, is PPE, which of course has been in the news so much in the last couple of years as being such a critical role in protecting our patients and staff. But we know that does have an environmental cost. In fact, a study from the PPE usage in England during the first 6 months of the pandemic found that the carbon footprint was equivalent to 245,000 barrels of oil, and had a significant impact, of course, on human health and ecosystems. But there were solutions, and the graph at the bottom right there shows that through rationalization where it wasn't required, through reusables, through local production and procurement, and better recycling, that could have been reduced by 75%. So there are real opportunities for us to systematically look through some of our plastics usage. So also a real opportunity for engaging trainees in this agenda. When I was a public health trainee in the UK, I was able to become involved in this and engage other trainees in this agenda. And there's actually a lot of progressive work going on here in Canada around this agenda. This graphic here is from the College of Canadian Family Physicians about embedding planetary health in medical resident training. And in fact, I have a medical resident who's doing his research project around inhalers and is providing significant leadership to help address this system change. So it can be real opportunities for student projects to actually add capacity to the system, but also building future climate leaders to move forward further system change. Finally, so about partnerships, collaboration, making sure that we're involved in all of the work that's going on by so many different groups around healthy public policies. This is just from the Health Officers Council, who adopted a WHO call to action. So Health Officers Council represents all of the medical health officers across the province. and they have committed to trying to take on and move forward these policy agenda items that we know will have us are required to take action on climate change. There's also work going on across health authorities and with universities to understand how we can adapt. We know that we can't avoid a lot of the impacts from climate change. That we're going to have to learn to live with them and make sure that we're protecting our most vulnerable citizens. So there is work going on to understand that community vulnerability to climate risks and create climate adaptation plans for our health systems and support municipalities to do the same. As I mentioned, there are groups across the countries. UBC's declared a climate emergency. Many municipalities around the Lower Mainland have declared a climate emergency. So there are real opportunities for us to be working together on this with partners across the country and across the globe. I'll just do a quick summary of what I think are some other opportunities or things that I've already spoken of. So it just, as I said, it's reframing the climate emergency as a health emergency. I know there's emergency fatigue and a risk of that, but we do need to respond to this in the same way that we responded to the pandemic. And part of that comes from under, our carbon literacy, our environmental literacy, and understanding the projections around temperature and where we're at, and what we need to do to address this issue. The policy influence that's so important. I know that can be a challenge for health systems around doing advocacy. It can be quite political, but this is an unprecedented health issue, and we need unprecedented action, going right back to the healthy public policies in the Ottawa Charter. System redesign. I gave a couple of examples of how we as health systems can do things differently and engage patients and engage providers to reduce our environmental impact. There is energy and environmental sustainability team working across the 4 Lower Mainland health authorities, and they've done a lot of work to reduce the environmental impact of facilities and creating BC Green Care networks to engage healthcare professionals in this agenda. Mentioned the adaptation I just mentioned around making sure that we're ready for these events that are happening, and making sure we're protecting our most vulnerable citizens. Training opportunities, providing those innovative opportunities for students and residents and other trainees to be involved in this agenda. And then strengthening our role as an anchor institution. UBC is an anchor institution. They're stable organizations that have a significant influence through their spend. So there's been a lot of work that's been done in the US and has been adopted in the UK and starting to be picked up in Ontario around really using our role in terms of making sure that the spend that we have is improving the population health, reducing income inequalities, reducing our environmental impact. So we actually have a huge opportunity as an anchor institution to do that. And with that, I will end, and thank you very much.